Hi guys, it's Oliver here from Ozone ASMR. Just a quick message before we begin today's roleplay to talk to you about Lymphoma Out Loud, or LOL, a charity founded by Charlotte Cox in the United Kingdom that aims to promote information about the cancer known as lymphoma. LOL's goal is to empower, educate, and ensure all young people know the signs and symptoms of lymphoma. All information in this video can be found on their website for further reading. Link in the description for more information, including how you can support, such as through donations. Any amount helps. This is a medical roleplay, as such, and should not be substituted for any medical advice. Please see your health professional or GP if you have any concerns regarding your health. Thank you very much for checking this roleplay out, and enjoy the rest of it. Hey, how's it going? Welcome to the Ozone Medical Center. My name is Oliver. Thanks for stopping by. I read in your chart that you're here for a lymph node check. Is this correct? I see. That's excellent. In fact, I'm very, very excited and very happy that someone of your age is coming in to have their lymph nodes checked for things such as lymphoma. How did you come to hear about this, may I ask? Okay, I see. So, did a bit of research, heard from it from a friend or online, Well, that is incredible, and I commend you for being brave enough and having the proactivity to come into the medical center to get checked up today and assessing your lymph nodes. Well, I suppose we'd better begin straight away. I've already checked your history and such, but I suppose we'd better begin with explaining what lymphoma is. And perhaps if we write it down and I'll tear it out, that way you have a handout sheet for it. Does that sound agreeable? Perfect. Well, let's begin with what is lymphoma. Lymphoma is a form of cancer that commonly affects young people, teenagers, young adults. Approximately 1 in 5 cancer patients have a lymphoma. Lymphoma is essentially a cancer associated with the lymphatic system in our bodies, which is essentially our defense system, or part of our immune system, and consists of many lymphatic vessels and organs. We have fluid known as lymph that travels around our body, and also lymph nodes where this lymph fluid drains toward and into. More specifically, these lymph node areas are in our neck, as well as our axilla, or our armpit region, as well as our groin region, as the major key areas we should be aware of. Today's process, I will be performing a physical assessment on you, just having a palpate or a feel of your lymph nodes to make sure that they are normal and what to expect and things to look out for, signs and symptoms. For example, key common signs and symptoms to be aware of include itchiness, swelling, extreme fatigue or tiredness, night sweats, as well as unexplained weight loss. They are, again, itchiness, swelling, extreme fatigue or tiredness, night sweats, as well as unexplained weight loss. So those are the common things to be aware of for signs and symptoms of lymphoma. Additionally, we may have other symptoms specific to an organ that has a lymphoma, as lymphoma can travel around the body. For example, if we are noticing a lymphoma in the lung or respiratory system, they may manifest as respiratory related symptoms such as shortness of breath or a cough. Another example of a specific organ or part of the body being affected by lymphoma could also be the abdominal region or the abdomen, where the patient may experience abdominal pains, constipation, or diarrhea. You can see how it's good to be aware of these base symptoms, those 5 we discussed: itchiness, swelling, unexplained weight loss, extreme fatigue or tiredness, as well as night sweats, as well as these other symptoms and signs that may manifest if the lymphoma is in a certain organ or part of the body. So, let's begin with your physical examination. And if you could just relax as best you can. This is a painless process. I just want you to be as relaxed as possible throughout today's exam. Again, I'm really proud of you and I commend you for getting this exam in the first place. And this is something you'll be able to perform on yourself on a monthly basis, preferably a monthly basis, so that you can detect any changes or abnormalities on your body, on yourself. So, let's get into it. I'll just be feeling around your neck, your axilla, or your armpit region, as well as the groin region for your lymph nodes. Let's start, and you can do this on yourself by feeling on this front of your face, the side of your face, in through here, just with the flats of your fingers here, like so. And again, we are feeling for a pea shape or a smooth pebble or a small rounded bump. Those kinds of feelings. We're going in a downwards motion as well with these. So starting here, let's work our way to the side of our neck. Gently tilt your head for me, please. Excellent, and good, just hold that position. Again, I'm just using the flats of my hands here to feel on the downward area of your neck here, like so. Just feeling for any olive sensations or a pea sensation or a smooth pebble sensation. And of course, we're going to try that on both sides there. If you could please tilt your head gently to that side, please. Yeah. just feeling in through there. Wonderful. Wonderful. That is perfect. Okay. Yeah, just feeling in through this region. Yeah. Take notes, as I would like you to. Like I said, check yourself monthly, please. Okay, let's move now to the back of the ear. The back of the ear. I have floppy ears, but hopefully you'll be able to feel on the back of your ear in this region. Again, starting from the top and working your way down. I'll just feel on you now. That's good. Okay, yeah. Not feeling any olive bumps or pea bumps or smooth pebble sensations there. Again, on the behind your ear. Perfect. And next, let's just do a little pinch on where the bend in your jaw is, in through this region, on both sides for me now, please. Just, relaxing your jaw. Take a deep breath if you have to. Again, you're doing fantastic. Just try to chill out and yes, that's it. Take it all in. Yeah, let's see how we go feeling in here. Just on where the bend in your jaw is, just lightly pinching. Again, feeling for any of those pea-shaped or olive-shaped or smooth pebble type sensation. And then we're going to go underneath the jaw, making sure your neck isn't too far up, not too far down, nice and neutral, like so. Just feeling back and forth in through this region. Right in there. If you're having trouble finding it, I'll just do it for you there. Excellent. Yeah, just in there. I hope that feels okay. That's not too uncomfortable. Okay, that's good. Excellent. You're doing very, very well. Now, let's have a look in the nape of the neck, or the back area, in through here. Again, using the flats of your fingers. Let's take a deep breath. No rush with these. Feeling for your nape. Again, any abnormal bumps in a downwards motion, keeping it consistent. Perfect. Just in a downwards motion. Okay, that's good. Next, I would like you to just gently shrug your shoulders for me, please. And we're going to feel on the underside of your collar, underneath your collarbone. That's it. This one here, or your clavicle, as we call it. Your clavicle, or your collarbone. Mine's pretty bony, as you can hear. But let's have a feel. Shrugging up underneath your collarbone, like so. Excellent. Make sure you check both sides, of course. If you're having trouble, just check that one for you there. Excellent. Yeah, just in there. And that's our neck region cleared. Now let's turn our attention to our axilla, or our armpit region. Now, don't worry, my nose is terrible. My sense of smell is horrible, so no stress if it's a bit smelly. I don't blame you. Let's have a feel now with our fingers in through the underside here, and I hope you can see underside of that armpit region, or axilla region. And I just want you to feel in a upwards circular direction against that rib cage. That's it, going in sort of circles like so, but up against that rib cage. And with your thumb, your free thumb, I'd like you to make sure it's just on the top there, making sure that you can feel the tissue and the muscle in between. Again, making sure there are no pea or smooth pebble or olive type shapes forming there, indicating some enlarged lymph nodes there. Try to make sure your testing arm is relaxed. I realized I had my arm up here when I was showing you, more so to make sure you could see that clearly. But please make sure that your arm is as relaxed as possible when doing this, not tensed up like I was. Make sense? Perfect. Let's continue. We're going to feel also the underside of our upper arm in through this upper arm region, like so. And of course, we want to perform that on both sides. So let's just quickly check that on you, and that should be pretty good. Next, I'll just get you to lie down and sit down for me. Lie down, sorry. I don't know why I said sit down. Lie down. We're going to check the groin lymph nodes. Now, as this is a bit invasive of privacy, I'll just explain, and I'll get you to feel on yourself in that groin region for any enlarged lymph nodes or signs of enlarged lymph nodes. Again, with the flats or pads of your fingers, I'll just get you to place them on the crease of where your hip starts to bend in that groin region. And we just want to feel gently pushing into a V motion into that groin area. Nice and firm, but also being able to feel in through there for any of those abnormalities we spoke about. So I just want you to feel down to the level of about short level, about where it would stop, where shorts would go on your legs if you were wearing shorts. So down to about that level, I want you to palpate and feel with your fingers there. Of course, don't forget to do not one, but both sides, 2 sides there for me. And that is going extremely well, fit, healthy, as expected. And now you will be equipped with the knowledge and understanding and practical knowledge to be able to assess yourself. And again, we are feeling in through the front, downward motion, in through the side of the neck, downward motion, both sides, in the back of the ear, behind the ears, as well as pinching underside of your jaw, where your jaw starts to make that angle and bend, as well as underneath your jaw in here, keeping your neck nice and neutral with this one, like so. Not up here, not down here, nice and ahead, straight ahead. And then with our back of our neck, our nape, we are also feeling downwards motion. And with our shoulders shrugged, feeling the underside or underneath our collarbone. That's the way. Or our clavicle, the anatomical term. That's our neck region covered. And then with our axilla, trying to relax this arm, feeling with the pads of your fingers underneath your armpit region. Get in there nice and deep, don't be afraid to apply a bit of pressure. Feeling for those enlarged lymph nodes, if there are any, and doing both sides in the process, please. And then in the groin region, feeling again with the pads of your fingers down to about short level, as though you were wearing shorts, in that V area, in that region where your hips start to crease when they start to rise up, that sort of area. Okay, again, I want you to be aware of any signs such as itchiness, swelling, extreme fatigue, night sweats, and unexplained weight loss, and to try and check yourself for any abnormalities every month. Very important to be body aware and have an understanding of the lymphoma signs and symptoms so that we can maximize the chance of a early diagnosis and get an early diagnosis, early treatment, and hopefully better outcomes in that regard. So, thank you again for coming in. You've been amazing. You're a legend. I commend your willingness to come in and be proactive with this topic of lymphoma. So, thank you very much for visiting the Ozone Medical Center. My name has been Oliver, and before you go, please don't forget to check out Lymphoma Out Loud down in the description box below, where you can find out more information about lymphoma, as well as information to support the cause, including donations. Thank you, and I hope you have a happy, healthy week. Stay awesome. Thank you to my amazing patrons, Stephen Underwood, Blaine Bettinger, Jessica Montez, Fading Muses, David Emanuelson, Anthony Espinoza, Here's Mikey, Curious Madcat, JJJ, Kenneth Clary, Griffin Kelly, Milano Gardner, Jake Griffin, Electra, Keith O, Josh Santana, Kylie Denton, Stephen Joyce, Joaquin, Megan, Gabriel, Patrick, Troy, Andres Olan Vasquez, James Peacock, Michaela Rajan. Thank you.